1 out of 65 Indian children between the age group of 2 and 9 are affected by Autism Spectrum Disorder, ASD.
Starts between the age, usually the diagnosis of the spectrum symptom starts between the age of 18 months.
There is a genetical history in the family. So is there any kind of a test to recognize autism before the child is born or during the pregnancy?
Father or both, because already they will be undergoing a turmoil in their as a young parent.
If autism is really neuro disorder, then how come some extraordinary brains like Einstein, Newton?
That's a mental hospital. You want me to drop over there?
Oh.
I was totally shocked.
Okay.
See, these kids have a cognitive abilities. That is where Einstein has come. There are high functional kids we are having. With a high IQ level we are having, above average IQ people we are having, many kids who are there. And they should be streamlined appropriate during their developmental process. I have many kids who have been extraordinarily, performing really, they are amazing. They need a, regular guidance and a structured program.
They generally keep their child secluded at home or they do home tuition. You're right, because they are either scared of that social stigma and what the people around them are going to think about.
Educate our kids who have to grow along with them, having the future into the question. In that, if the social setup is not supporting, especially as a child is growing up, in the play area if the child is not accepted, in the school if the child is not accepted. And we have to understand, we have to extend our support.
After listening to you, I understood that they are definitely not mentally retarded kids.
Yes, they are very special. Crying with emotional outbursts. People start gathering or looking at them in a very strange way. Just, ignore it and accept them.
Hi, this is your host, Ankura Gupta from She Squad Tejaswini. Today, we have with us Dr. P. Sumitha Hemavathy, founder and director of CAPAAR, Center for Advanced Pediatric and Adult Rehabilitation. Her enriching 20 years plus experience in neurotherapy led her to create CAPAAR Special School, a space where children with special needs thrive under her expert guidance. Dr. Sumitha is also the proud recipient of 8 prestigious awards in her field, and the most recent being the Best Physio Entrepreneur Award 2025. Hi, Dr. Sumitha. Welcome to She Squad Tejaswini. Could you please tell our audience a bit more about yourself?
Thank you, Mrs. Ankur, and thank you so much for the invite. And I really appreciate the awareness which you are creating for the common people. And as you know, I'm a physiotherapist with 25 years of experience. And my journey at CAPAAR, or the thought of CAPAAR, started to bring and to serve the kids who are in need under one roof. This was, I started CAPAAR 10 years before, where when I was working, I noticed that the parents were running around pillar to poles for different types of therapies. So the thought came, all the therapies should be given under one roof. So I started CAPAAR 10 years before, bringing all the therapies together under one roof, which is called, which we call it as an integrated therapy.
Wonderful.
And especially we started addressing neurodevelopmental disorder kids, and under the category of autism, ADHD, and also the developmental delayed.
Okay, wonderful.
And to tell more about me, so apart from CAPAAR, the journey at CAPAAR, I come from suburbs. So I thought, the struggles when we move into, as a therapist, when we move into, the city or a metropolitan city, the struggle was larger. So in my clinic, I have 100 plus therapists, which is dominated by female therapists who are from, moving from villages and not majorly from the cities. So I'm a female entrepreneur.
Wonderful, doctor. Wonderful.
This is the journey about CAPAAR for the past 10 years.
Yeah. So, doctor, we are going to discuss today specifically about autism and what are the myths and misconceptions related to it. So let's begin with our first question. 1 out of 65 Indian children between the age group of 2 and 9 are affected by Autism Spectrum Disorder, ASD. So if I go by this data, this means about 2 million children in India have ASD. So could you tell our audience in simple words what exactly autism is?
See, as you stated, it is autism spectrum disorder. When we use the word spectrum, it
Yes.
is not one disorder, it is a multiple disorder. So, a general scenario, we say that it's a neurodevelopmental disorder, which is also associated with communication and, behavior delays.
Mm-hmm.
But it's not only that, it's more than that. It's like, a motor challenges there, or cognitive challenges will be there, or their activities of daily living. That challenge will be there. Apart from that, there are emotional challenges. When I say a motor challenge, it is very easy for a child. We believe that, the milestones achieves, or a grown up, a 3 or 4 year old child, it becomes very challenging for the child to even write or a normal ball throw and catch for that appropriate age, or even
Mm-hmm.
a cycling. So these are the challenges which has been ignored. It generally states that, a communication and a behavior or a social challenges which we see. It's not only that. This is also the hindrance which most of the kids who are falling under the spectrum, they fall under.
Okay.
So apart from the social and the communication challenges, we should also concentrate more on their motor and also on their cognitive behavior challenges. When I say a cognitive behavior, the child has to go sit in the class, the child has to learn, and their
Right.
tolerance, all these things, their attention span, all these things will fall under this big word called autism spectrum disorder.
Okay. So if we talk about the early signs and symptoms, what are these symptoms which as per you are missed or misunderstood by the concerned parents?
See, this is as I said, this is a neurodevelopmental disorder. So it affects all the developmental aspects, especially what all we parents, as a parent, what I understand when I interact with parents when they come for the diagnosis is many times the child will slowly deteriorate in name call response, or there will not be eye contact. The babblings would have been reduced, and also they will be sitting and playing in one corner. They will not know who is around. They slowly
Okay.
start, they will not address amma or mama, papa. All this will be slowly, it would have deteriorated. There will be a regression noticed. But
Okay.
many times what happens, as you know, that autism affects mostly the male child. It is a
Mm-hmm.
common myth in India. We say boys, they talk late. Okay.
Yes,
So
true.
what happens
Yeah.
is, or no, your uncle would have talked late, or aunt would have
Yes,
talked late, or my neighbor would
true.
have talked late.
Mm.
So these are the things where they get postponed in their diagnosis with the early intervention.
Hmm, hmm,
So
hmm, hmm.
when we notice as a young parent, when we notice when these symptoms has been reduced, it has to be addressed to the pediatrician or a developmental pediatrician so that they can guide us appropriately for the early diagnosis.
Okay, got it. So one should not delay it by just thinking what the other family members think. It's fine if he's speaking late or she's speaking late or walking late. It happens because every child has a different way of responding. So one should not exactly wait for this kind of a
Exactly.
thing and
Exactly.
immediately come to the doctor.
Immediately they have to report it to the developmental pediatrician or to their family pediatrician or the family physicians.
Okay,
That will be more advisable.
that is more advisable. Right. That's what the
Early
message.
the better.
Yeah.
Yeah,
So this is the message we should be giving to the parents, the early the better.
exactly.
Okay.
Early the better. Even the small symptoms has to be addressed.
Yes. So this is about the child development when if a parent is approaching early. I'm sure even for the family also, it's a good thing if they approach the doctor at the right time because they themselves are
Exactly.
impacted a lot. So what do you have to say
Exactly.
about it?